Pharmacists prevent over 2 million medication errors annually in the United States alone. Behind every prescription lies a profession spanning thousands of years, from ancient herbal remedies to modern biotechnology. This introduction to pharmacy covers what pharmacists do today, career paths available, education requirements, and why this field remains essential to healthcare. Whether you are considering a pharmaceutical career or want to understand what happens behind the counter, this video provides comprehensive information about this vital healthcare profession. Pharmacy comes from the Greek word pharmakon, meaning medicine or drug. This ancient origin connects to thousands of years of healing tradition. Pharmacy is the art and science of preparing, dispensing, and ensuring proper utilization of medications, along with providing drug-related information to the public. This definition captures both technical expertise and patient care responsibilities that define the profession. The joint FIP or WHO guidelines define good pharmacy practices, the practice responding to the needs of people who use pharmacists' services to provide optimal, evidence-based care. The pharmaceutical profession has incredible roots tracing back to ancient civilizations. In the ancient era, Egyptian priests created the first recorded pharmaceutical practices around 3000 BC. Greek apothecaries developed systematic medicine preparation approaches that influenced practice for centuries. During the Middle Ages, Islamic scholars preserved and advanced pharmaceutical knowledge, while European monasteries became herbal medicine centers. The transformation accelerated in modern Europe during the scientific revolution, when the field separated from general medicine as a distinct profession. This evolution continued through American pharmaceutical development, where colonial apothecaries established foundations for today's profession, eventually growing into the modern pharmaceutical industry. Pharmaceutical careers offer significant diversity. Here are the main areas where pharmacists work today. Retail practice includes community pharmacies like CVS, Walgreens, and independent stores. These pharmacists serve patients directly, providing medication counseling, managing chronic diseases, and offering clinical services like health screenings and vaccinations. Hospital practice operates within healthcare facilities. Hospital pharmacists collaborate with medical teams, ensuring patients receive correct medications at proper doses, handling complex cases and specialized drugs unavailable in retail settings. Clinical practice represents the profession's future. Clinical pharmacists work in doctors' offices, clinics, and hospitals as healthcare team members. They conduct medication therapy management, helping patients optimize drug regimens for better outcomes and fewer side effects. Research and development pharmacists work in the pharmaceutical industry, discovering new medications and bringing them to market. The biotechnology era creates opportunities in developing personalized cancer treatments and new therapies for rare diseases. Specialized fields include oncology pharmacists working with cancer treatments, pediatric pharmacists specializing in children's medications, and geriatric specialists focusing on elderly patients' unique needs. The industrial era transformation created these diverse pathways, and American pharmaceutical entrepreneurship continues expanding what pharmacists can do in healthcare. Becoming a pharmacist requires dedication with a straightforward path. Here's exactly what you need to know. First, complete prerequisite courses, typically 2 to 4 years of undergraduate study focusing on chemistry, biology, physics, and mathematics. You don't need a specific major, but must complete required courses. Next comes the Doctor of Pharmacy program, PharmD, taking 4 years. PharmD programs include extensive hands-on training through rotations in different practice settings. You'll work in retail locations, hospitals, clinics, and specialized areas. After graduation, pass 2 licensing examinations, the North American Pharmacist Licensure Examination, NAPLEX, and your state's law exam, MPJE. These ensure you understand pharmaceutical science and legal practice aspects. Many pharmacists pursue additional training through residency programs, especially for hospital or specialized clinical roles. These 1 or 2 year programs provide intensive, focused experience in specific practice areas. Continuing education is required throughout careers, typically 30 hours every 2 years, ensuring pharmacists stay current with new medications and changing healthcare practices. The complete journey from prerequisites to licensed pharmacist typically takes 6 to 8 years, entering a profession with excellent job security and direct patient impact. Career prospects and compensation matter when considering this field. The pharmacist job market remains strong, with Bureau of Labor Statistics projecting steady growth. While retail has some market saturation, clinical roles expand rapidly as healthcare systems recognize pharmacist value in patient care teams. Salary ranges vary by specialty and location. Entry-level retail pharmacists typically earn $120,000 to $140,000 annually, while hospital and clinical pharmacists start at similar levels with greater advancement potential. Specialized roles like oncology or infectious disease reach $150,000 to $180,000 or more. Work-life balance depends on your chosen path. Retail pharmacists might work evenings and weekends but have predictable schedules. Hospital pharmacists may work shifts but typically don't take work home. Clinical pharmacists usually work standard business hours with good work-life balance. Growth opportunities are plentiful. You can advance to management, open your own independent business, move into pharmaceutical industry roles, or pursue specialized clinical positions. The biotechnology era creates new career paths in areas like pharmacogenomics and precision medicine. Emerging roles include telepharmacy, where pharmacists provide services remotely, and pharmaceutical care in non-traditional settings like workplaces and community centers. Digital health integration creates opportunities we couldn't imagine just a decade ago. Why this profession matters more than ever in today's healthcare landscape. Patient care sits at the heart of everything pharmacists do. We're often the last healthcare professional patients see before taking medication home. That interaction, checking for drug allergies, explaining proper dosing, identifying potential interactions, literally saves lives daily. Pharmacists improve public health on a large scale. We make healthcare more accessible by providing services in convenient locations without appointments. During the COVID-19 pandemic, pharmacists administered millions of vaccines, demonstrating our important role in public health emergencies. As healthcare team members, pharmacists bring unique expertise that complements what doctors and nurses provide. While physicians diagnose and treat diseases, pharmacists optimize medications used in treatment. This collaborative approach leads to better patient outcomes and reduced healthcare costs. The various disciplines in pharmacy contribute specialized knowledge to healthcare. Oncology pharmacists ensure cancer patients receive precisely dosed chemotherapy. Pediatric pharmacists calculate safe medication doses for children. Geriatric pharmacists help elderly patients manage complex medication regimens. Looking ahead, the profession faces exciting challenges and opportunities. We are moving toward more personalized medicine, where genetic testing helps determine the best medications for individual patients. Pharmacists are increasingly recognized as essential healthcare providers, with many states expanding our scope of practice to include more clinical services. The importance of profession has never been clearer as medications become more complex and healthcare more specialized. The need for medication experts continues to grow. Let's recap what we've covered in this introduction to pharmacy. We've explored how the field evolved from ancient herbal medicine to today's sophisticated healthcare profession. We've seen diverse career paths available from retail and hospital practice to clinical work and pharmaceutical research. We've outlined the education path, prerequisite courses, 4 years of PharmD study, licensing exams, and optional residency training. We've discussed career prospects, including strong job security and competitive salaries across various specialties. Most importantly, we've seen why this field matters. Pharmacists are medication experts who ensure safe, effective drug therapy while improving access to healthcare in communities everywhere. If you are considering a career in this field, I'd love to hear what interests you most in the comments below. Are you drawn to direct patient care, research and development, or perhaps one of the specialized areas we discussed? Thanks for watching, and remember, behind every medication is a pharmacist working to keep you healthy and safe.